Hello, and welcome to today's webinar on how to increase occupancy by leveraging your preferred pharmacy. I'm Lois Bowers, Senior Editor of McKnight Senior Living, and I'll be your moderator. With occupancy pressures and staff turnover no doubt affecting your senior living community as they do others across the country, you may be seeking new ways to improve your census and provide high-quality services and care to residents. During this webinar, you'll learn how you can leverage a relationship with a health pharmacy to accomplish those goals. We're pleased to have Brady Ford, Director of Account Management, Strategy, and Support at Omnicare, a CVS company, with us today to describe the single pharmacy model concept and how it could benefit your community. We'll hear from Brady in a few moments, but first we have some housekeeping matters to address. First, I'd like to let you know that today's slides are not available for download. If you think you're experiencing audio difficulties with this broadcast, please first check the volume control on your computer. We found that this is the most common cause of hearing issues with presentations like this one. The sound should come from your computer speakers. If the volume control doesn't appear to be the issue, then please click the red Test Your Connection button under the slides. If necessary, click the Chat Live button to receive additional assistance. Please also only keep one browser window open on your computer to prevent echo. Also, we will have time for questions and answers at the end of today's presentation. If you have any questions about the information presented, please feel free to send them directly to us at any time during this hour by entering them into the Ask a Question box below the slides and clicking on the red Submit button. This educational offering has been approved by the National Continuing Education Review Service of the National Association of Long-Term Care Administrator Boards for 1 clock hour. The CE credit is available only for those who have registered and are listening live. If you'd like to earn a certificate, you must register for the webinar at mcknightseniorliving.com/April25webinar. Log on and listen on a computer that is separate from those of others who wish to receive credit. Click on the red Get My CE button in the right column for more information about CE. Please note that you must stay tuned to this event in its entirety during its original broadcast to receive a certificate. Today's program is made possible by support from Omnicare, a CVS company. Please visit the company website at omnicare.com. But remember, do not interrupt this webcast presentation if you would like to earn the CE credit. Finally, this session will be archived and available on demand shortly after this live broadcast. You can access the webcast again at no cost, and others can experience it for the first time, again at no cost, by simply going to the registration page to enter this studio. The web address is mcknightseniorliving.com/April25webinar. You also can use the link you received via email or can visit our website, mcknightseniorliving.com, and click on Events in the navigation bar at the top of the page and then on Webcasts in the drop-down menu. As I mentioned, however, accrediting bodies dictate that CE credit may be given only for attendees of this live broadcast. And now I'd like to tell you a little bit more about today's featured speaker. Brady Ford joined Omnicare in 2015, and moved into his current role as the company's Director of Account Management, Strategy, and Support in June 2018. Brady earned his Bachelor of Arts degree in Political Science at the University of Texas at Austin. He has extensive experience in working with assisted living and memory care community customers and, in fact, has a professional background in long-term care management. He earned his assisted living administrator's license in California and Texas, where he managed continuing care retirement communities as well as standalone assisted living and memory communities for 10 years. I've taken a peek at his slides and can tell you that he has a lot of helpful information to share. So with that, I'm going to turn things over to Brady so he can begin his presentation. Brady?
All right. Well, thank you so much. And good afternoon, everyone. Thank you for joining the presentation today, where we will be discussing the benefits of having a house pharmacy, and then leveraging one of your key partners to increase census. So as you heard from my background, I have experience working in the senior living environment specifically skilled nursing, assisted living, and memory care, and now a dedicated senior living pharmacy. So for today's discussion, we'll be focusing primarily on assisted living and memory care. There'll be some reoccurring themes today, one of which is my use of the term house pharmacy. And so what I'm referring to when I say house pharmacy, I'm talking about your contracted pharmacy, your preferred pharmacy, you may call it, and the pharmacy that provides your consulting and medication administration records. And what I want to hit home today is that you, operators of assisted living and memory care homes, you have your own pharmacy. This is your house pharmacy. You've made the decision, or potentially someone has made the decision for you, to contract with the pharmacy to improve your operations and the lives of your residents. So I challenge today the way you were thinking is you have a pharmacy that works for you and your residents. And this is a house pharmacy concept. So learning objectives for today, first, what is a single pharmacy model concept? And if you're unaware, we'll cover some basics about long-term care pharmacy, and then, understand the community benefits of utilizing a single pharmacy provider. Basically, what you can expect in terms of services, benefits to your community and residents, and how they could impact some stressors to your business. And lastly, how do you convince your residents or responsible parties that choosing your pharmacy will benefit them? Or how do you direct them throughout the touring process that they are led towards choosing your pharmacy of choice? We'll look at a team approach to pharmacy selection and that all of your staff play a part in setting your community up for success. And all woven into this discussion, we will tie it back to strategically marketing your community to make the biggest impact on touring residents and responsible parties. Now, as we look at the agenda for today, it's important that we look initially at some industry dynamics that place some pressures on your census, your operations, and your overall staffing abilities. Essentially here, we're establishing a problem statement that we will set us up to address solutions later on. We'll look at some signs and symptoms that you have too many pharmacies that are impacting your ability to operate a medication management program at a high level, and the solutions that streamlining your medication management program will bring to your overall operations. So now we'll look at some industry dynamics that unfortunately are commonplace throughout the country. So to start it off, occupancy pressures. In speaking about those complex industry dynamics, the senior living industry is facing occupancy pressures that are significant. 85% average occupancy nationwide, which is a declining trend relative to the same period of the previous year, which means profitability pressures exist. So you need residents to be safer, live at your community for longer, because turning that bed over is a major challenge you face. There's a wide variety of housing options for seniors, either in the home or out of community, increasing expectations for services in a community as well. And there can be assisted living communities on opposite corners of the same street, similar to Walgreens and CVS. So competition is fierce for potential move-ins. Next, staff turnover, averages 31%. This represents high turnover, obviously, and I would say probably, a lot of you face even higher turnover rates. I know I did. And this is due to complexities in recruiting, hiring, retaining, and training of quality staff, which our customers need for quality resident care. There is also a significant need for easy-to-use pharmacy systems that can withstand high staff turnover in order to weather the storm of high turnover and retain quality care for residents. You need medication ordering systems, similar to what long-term care pharmacies offer, to make the job easier and more efficient for staff. Less complicated systems so that a new staff member, potentially with limited training, can insert themselves and provide resident care at a high level. So to sum it up, there's a lack of streamlined efficiencies to offload workforce risk. evolving state regulations. So 50% plus. That represents states that will be proposing or formally reviewing or considering changes that would affect assisted living communities. Truly more regulations, it's represented by the proliferation of the assisted living and memory care setting. So to sum it all up, you've got occupancy pressures, you've got turnover and staff pressures, and regulations which are challenges that you face daily. And I'm sure I'm having a lot of head nods out there as you hear this. So I want to take a deeper dive into occupancy pressures. Seeing as this presentation is titled Increasing Your Census by Leveraging Your Preferred Pharmacy, or as I like to call it, your house pharmacy, first, overbedding. It's created a very competitive market where you likely have additional resources for lead generation. You have perfected that touring process. Potentially you're paying out referral fees to search agencies, and most importantly, you're looking for a competitive advantage. Second, as I mentioned on the previous slide, seniors have other options in moving into an assisted living environment. But as we all know, these many times are 2 to 3 times more costly, and they don't solve for socialization issues. These alternative options are placing seniors at home longer than in the past, which causes them to move in a more frail state, taking more medications, needing more services, and potentially limiting their ability to take full advantage of additional services such as dining and activities. And due to their frail state upon movement, this is causing you to lose residents at a much higher rate and causing you to turn apartments more frequently. Death and discharge due to high acuity environments such as long-term skilled stays or hospice houses are placing additional significant strains on your occupancy. And lastly is operating cost increases. The resident fees are also increasing, which ultimately is making it more challenging to afford the cost of assisted living fees, limiting the candidate pool to move into your community, and also increasing competition for those residents. When it comes to staffing pressures, I'm going to let this slide load. Okay. What you may be finding is that you're competing for staff with non-clinically related industries, such as food service, hospitality, household services, and the list goes on. I'm sure we all see, for example, that a local fast food chain is hiring at $13 an hour, and minimum wages are increasing steadily. In addition, care staff are faced with some work environment challenges, such as evening shifts, knock shifts, all very difficult to find someone to cover your shift in times of need. The aging population, the more frail population that was mentioned on the previous slide, creates pressures on the care staff, which are likely having to do more care many times without additional help. Then there's the topic of having to adjust staffing based on census, either by placing additional work duties on the universal worker, such as housekeeping duties, laundry duties, dining services. We're asking our care workers to be more agile than the past. And unexpected overtime due to call-offs, and at times inflexibility to allow for days off create even more challenges than in the past. So as we've seen and heard, there's some serious challenges to operating your business in terms of profitability due to census, staffing challenges, and even from a regulatory standpoint. Now we turn towards a single pharmacy model, and as you can expect, how leveraging one of your key operational and regulatory partners to address many of the concerns we highlighted in the previous slide. And my challenge to you, as you listen in, is do you value your partnership with your pharmacy? Do you view them as a vendor or a partner in resident care? And I can tell you that working for each side, the assisted living side as well as the pharmacy, is that our partnership, in my opinion, is underutilized. The purpose of the pharmacy is to be your partner in medication management, compliance, and staffing. And from the assisted living standpoint, you should be able to view your pharmacy as an enabler to resident care, a trusted partner that you can leverage when speaking to families about their loved ones' medication needs. And we all know the story of mismanaged medications at home, leading to a hospital stay and the need for a safe discharge. And from our research, we see that approximately 75% of residents are in need of medication management. They're coming to you for an answer. So use your house pharmacy when speaking to these residents in need. In terms of a single pharmacy concept, let's look at some basics of why you have a long-term care pharmacy. By understanding some of these basics, we can root ourselves into why a single pharmacy concept is helpful to your operations. So first, your residents are looking for a solution to their medication management needs. As I mentioned, 3/4 of them are coming to you with an expressed or underlying desire to improve their lives through a professional managing their medication. You then need to fulfill that desire by having a partner that can deliver medications directly to your community at any hour of the day and any day of the week, and have the medications that they need. The most basic of pharmacy functions is having medications available to the resident in that time of need. Next, you need a system to keep track of the medications your residents are prescribed, or track medications that they are refusing. Medication administration records, or MARs, or TARs as you may call them, are essential to your operations and vital from a compliance standpoint. Needless to say, you are not in the MAR business, but your pharmacy is. The pharmacists are checking each medication to ensure contraindications are avoided, dosing is appropriate for age and diagnosis, and are safe for residents to ingest. These then approved medications are printed on a MAR or uploaded to your electronic MAR and verified for your care staff or med techs to provide the medication. Consultant pharmacist, truly your partner in compliance. And if you're in a state that requires a consultant on a regular basis to destroy medications or review medications or both, you understand well the impact a consultant pharmacist can have on your business. However, most states require some form of consultant pharmacist, and therefore you contract one in some form or fashion. Equipment. So from fax machines, medication cards, treatment cards, these are all items provided by most long-term care pharmacies. And these items, just so you're aware, cost anywhere from $2,000 to $5,000, all of which are expenses that you don't have to incur as your long-term care pharmacy pays for them to be at your community. In addition, keeping residents' medications safe, locked up, and organized for safe administration, all incredibly important from a compliance standpoint to avoid drug diversion and keep residents' medications safe for routine and safe administration. We look at technology, either from a convenient e-refill option, potentially peel-off stickers you can easily fax in, or scanners you can plug directly into your PCs that allow for ordering. There is technology made available by pharmacies that enable your staff to do their job easier, quicker, and safer. And as more and more communities turn to an electronic health record, many times with an EMR component, to take full advantage of the benefits of e-refill capabilities, I'm talking about electronic refill capabilities, you must interface with a pharmacy that has a connection to your EMR vendor. Otherwise, your investment isn't fully utilized. It is important, final note, the underlying context here, retail pharmacies cannot offer this type of support to your community. They don't interface with your EMR vendors, they don't provide equipment, they don't have consultant pharmacists, or produce medical records, or provide medications and packaging that allows for the safest and most efficient med paths. I'm going to forward the slide here. Oh, went too far. There we go. Okay. Let's look at a test case now of Mary. Mary is 88 years old. She has COPD and she has dementia. A situation all too common. Mary falls at home and is admitted to the hospital. We see two separate tracks. One that is likely a bit more common, at least for the first major fall, especially if family is not fully ready for mom to move. The first, she is admitted to a skilled nursing setting. She is then discharged to home, with home health for a brief period. Then as services diminish, her condition worsens and she is readmitted to the hospital. Once again, I'm sure a lot of nods in the audience, as most are familiar with this scenario. Now, as you can imagine, you and your community can mitigate many of these issues that are causing Mary to end up back in the hospital. You can stop this cycle. And I'm not telling you anything that you don't know, but maybe here's a different take. Your purpose of providing a safe, nurturing environment is reliant on providing a holistic approach to Mary's care. That means when you're talking to her family about moving into your community, you have a commitment to them by offering her the services that will help diminish the likelihood of her heading back to the hospital and into the same cycle. This isn't just a pitch for pharmacy, so making sure that she has a visiting MD seeing her regularly, ensuring her DME is all set up for safe ambulation. But this also means that we need to ensure her medication regimen is accurate and readily available for her. In terms of emergency services, ensuring stat deliveries for a UTI or those behavioral medications that she needs. All this to reduce the likelihood of her going back to the hospital. Now, we aren't only caring for the resident, we're also caring for the adult child. Their lives have been in constant worry. They're going to doctor appointments nearly weekly, and the text string titled Mom's Caregivers with all their cousins and aunts, they deserve a weekend enjoying their grandchildren and not worrying about mom. So this is the message to tell to increase occupancy. You and your community have the resources to care for Mary and provide the dignified life she deserves. You have a pharmacy that can meet the complex needs of a person with dementia. You have the dining services to ensure that she has nutrition and eating habits fit for someone with dementia. You can change lives. You do change lives, just about how you tell the story. All right, so how often have you been in the search for a product or service and you approach different companies? There we go, we're on the right slide. Okay, you approach different companies only to not choose the one that has the best deals, the most glamorous marketing campaign, the shiniest new toy and hot item on the market. But you choose the one that spoke to your situation and offered a customized solution. So when a prospective resident took a week's worth of pills in a day and ended up in the ER, they are looking for a customized solution. When picking up dad's medications, put the adult child at the pharmacy 5 times per month. They are looking for a customized solution for medication delivery. And as previously mentioned, competition is fierce. People aren't always looking for the newest. They're looking for what is the best fit for their issues. And differentiate yourself in the marketplace, emphasizing that this is their new home and they have a pharmacy dedicated to their safety. In terms of resident care advantages, as we all know, the quality of care is often dependent on the quality of caregivers. In an industry where longevity is scarce but highly valued, the type of caregivers that you trust to care for your mother, it's often we stack the cards against their success and ease of use for our care staff. A significant piece of this is how they have access to medications for their residents and where they can go to get medications in a pinch. And what that looks like is having 10 pharmacies for your 30 residents. What less than quality looks like is having to call a daughter that lives 2 hours away on a Sunday because you need some Pepto-Bismol for a resident with a stomachache. And what unfair looks like is having to wait 2 days for a mail-order pharmacy to FedEx a necessary medication. All of these anecdotes place undue stress on our caregivers, and they are the front line of seeing their loved residents suffer. Make the caregivers and nurses' jobs easier by having all residents use one pharmacy. In terms of knowing where to go to get meds 24/7, 365, and with a company they trust that there's going to work with their prescribers, what this results in is more time with residents without having fire drills about trying to get medications there for a resident in need. The next, errors. So the crux of errors is obviously not having the medication when you need it. Holes in your MAR. that very ugly phrase that you try to avoid. Also errors occur because med aides are hurried. They have pressing issues, maybe a resident is yelling at them, and mistakes happen when stress is turned up. So proper and consistent labeling on your medication cards is also a factor. When you have a med cart full of bottles or a mixture of pharmacy labels, you're asking your med techs to make another judgment call, another deciphering of a prescription label to determine if a medication belongs to a resident. And anecdotally speaking, the consistent labeling and organization of a cart leads to less errors. Then, of course, we see some basic staffing advantages related to the speed of medication pass. It's clear that advantages with packaging and labeling, a consistent process in the med pass leads to a speedier med pass. And when your staff is able to utilize their technology, their EMR for refills, you see an efficiency increase. So as you see here, the concept of having your own pharmacy, the idea that this is your home and your place of work, and you have a pharmacy that works for you, is a major advantage when utilized to its highest potential. All right, now I'd like to go through a quick exercise, a litmus test, if you will, to determine if you have too many pharmacies in your community. So first, do you have space challenges in your cart? Are you concerned about new residents moving in because you don't have space? Do you find yourself storing medications in your overflow cabinet? If you're having space concerns in your cart, you're likely having too many pharmacies in your community. And when a customer inquires to us about having another cart, this is one of the first things that we initially assess, is are you using the space adequately? Are bottles overrunning your cart? Med carts are intended for the preferred packaging method, which is typically a blister card, or you may call it a bingo card. Are your med techs confused about where to order meds? Now, this is a question you can ask new and existing colleagues, and a clear predictor of errors and inefficiency, which for med techs on the knock or weekend shift, when they don't have a nurse oversight or a charge nurse present, are there more holes in your MAR? They may find it more difficult to get meds from families or residents on weekend hours when facility transportation is limited or non-existent. And are your residents that rely on family missing doses? Are you likely having a pharmacy problem if this is the case? Do you have overtime with your med techs? This is likely due to a slow med pass and a symptom of too many pharmacies. Do you have low e-refill at your home? Once again, it's electronic refill. Now, as mentioned below, this could be due to not utilizing your EMR, as retail pharmacies don't connect to EMR vendors. Do you have hospitalizations due to easily addressable diagnosis such as a UTI? Does the resident's pharmacy have the capability to get antibiotics to them quickly? Are you experiencing med errors and a mess of a cart? So as you see, placing eyes on your med cart and MARs on a regular basis is key to identifying if you have too many pharmacies at your community. So identifying you have a problem with too many pharmacies at your assisted living facility is the first step, but knowing how to do something about it is the next step. Resident choice, always a factor and one that should always be respected. However, there are approaches to leading a resident and responsible party to the pharmacy that best fits their needs, your house pharmacy. People typically only do something when they feel like it's their idea or if they've fully bought into the idea. The next section I'll go through provides some training that we cover with customers to A, align their teams around some central themes, so creating a clear link of how their pharmacy benefits them, and then B, then are able to fully explain the benefits of their pharmacy to this prospective resident. So as we look at this section of the agenda, we'll cover how to sell your house pharmacy, what the message looks like to your staff about why you have a pharmacy, i.e. how it benefits them. Then transition into how your pharmacy benefits the resident. Basically, why residents choose your pharmacy impacts you, staff members, and then we'll talk about two key points emphasized when presenting the pharmacy selection to the resident and responsible party. So in order to understand the why behind recommending your pharmacy, there needs to be a familiarity of the community benefits of resident safety and staff efficiency. Two things I'm going to hit on really heavily now. To my point of people aren't typically bought in unless they know how it affects them, I emphasize two key points. These are simple points. The pharmacy allows for greater resident safety and staff efficiency. So let's center ourselves around those two key messages. The message is catered towards Omnicare's long-term care pharmacy, but these points may be similar to your long-term care pharmacy. And in terms of resident safety, what staff, the executive director, resident service director, your community relations director, what everyone needs to know about resident safety is the following. Medications on hand keep residents more safe, more likely living in your community for longer periods of time, which without a doubt impacts your census. Your house pharmacy is suited for this stage of life, the latter stages in life of our residents, because not all pharmacies are created equal. For an example, when you're a child or young adult, you infrequently take medications and most often simply need an antibiotic for the occasional illness. Retail stores fit your needs at this time, as they are there when you need them, and it's no problem to swing by for a script, and your health is not overly compromised. Potentially as you age, you require some maintenance medications. Maybe you take 2 to 3 meds to keep healthy or in shape, and likely a mail order program has been introduced to you and meets your needs. The delivery model and customer support model is ideal for your needs at this mid-stage of life. Plus, there are likely some cost savings for using a mail order program. Okay, now, imagine you're 85 or 88 like Mary. You take more than 10 medications. You take over-the-counter medications. You probably take some controlled medications, non-controlled routine prescriptions as well. Each and every day, your health is at the forefront of your mind and potentially the most important consideration, but most definitely the important consideration for the decisions of your family. And they're all about optimizing your health and lengthening life. You need to live in an assisted living community to help care for your basic needs because you can no longer function at home safely. At this stage in life, you need a long-term care pharmacy, from the delivery model to the features that allow your community staff to manage your complex medications, to the clinical expertise offered. The transition to a long-term care pharmacy specializing in geriatrics is symbolic to passing the baton to an expert in this stage of life, geriatric care, where health is the most important for longevity, and one misstep can lead to a rapid decline. That's why hours of operation are equally important, ideally 24/7, 365, because emergency needs don't happen between 9 to 5 Monday through Friday. And that one medication, that one antibiotic, that one pain pill can make all the difference between sending a resident out or being able to wait till they can see their primary care physician on Monday. Now, another very important message to your key staff is how much better their operations will be when they make referrals to their house pharmacy. Now, we've covered these already, but quickly, they're convenient ordering practices. The benefits of the standardized packaging, not in vials, and quick administration due to integration with technology. So to reiterate, the message to staff of why a house pharmacy is resident safety and staff efficiency. All right. Now, how do you then convey to prospective residents why your house pharmacy is the best choice? So we've covered the differences between a specialized long-term care pharmacy offering and those of retail. Similarly to the messaging to your staff, we're going to focus on 2 key points that you'd communicate to prospective residents and responsible parties. First, your house pharmacy is convenient. Simple as that. You're looking for a total care solution for your loved one when you move them into an assisted living community. That includes the benefits of not having to order and pick up medications for your loved one. There's always those family families that want to retain some sense of control over care. And there is inherently some guilt involved with moving mom or dad or aunt or uncle out of their home. But when you talk about guilt-free weekends, going out of town knowing their loved one is being cared for, and now they can rest easy. Also, everyone loves free. So, talk-up medication delivery is free of charge. And that includes stat deliveries as well, or emergency deliveries. You can receive all your medications from the same pharmacy, over-the-counter medications included, and for special value as well. So they, responsible parties likely see how many vitamins and supplements, Metamucil, drops, wraps, and hoses that their loved one uses. And to know that you can get all of that from the same pharmacy is incredibly convenient. They introduce the technology they'd expect. So pay their bill online in an easy-to-read statement just once a month. They'll review their loved one's medications easily online or from their smartphone, or speak directly to a dedicated senior living specialist that can answer questions about their billing or Part D questions. So next, comes safety. Safety and convenience resonates with families, but safety especially hits home with the audience as the length and quality of their life is the primary reason they're moving their loved one into an assisted living community. Explain to the family that choosing your pharmacy allows for medications to be on hand when needed. The labeling and packaging allows for greater oversight and safety from the staff who will be administering their medication. Plus, as specialists in geriatric pharmacy, you can rest assured that a professionally trained pharmacist in elderly medications have checked for duplicative therapies. They have reviewed for drug-to-drug interactions. Because most seniors see more than one doctor, from a podiatrist, a neurologist, their PCP, their cardiologist, the orthopedic doc. It's necessary to have a pharmacy to filter all those medications that come through, because these physicians are not talking to one another frequently or at all. In one slight med change, a dosage increase, or an OTC or a supplement change could easily cause dizziness, excessive bruising. It could cause a fall that could be seriously detrimental to a resident. And by channeling medications through a specialized long-term care pharmacy, it's being responsible for resident care by taking every precaution necessary that the medications don't have an adverse effect. So to reiterate, by speaking to residents and responsible parties about the convenience and safety of your house pharmacy, you're setting yourself up for them to choose the pharmacy of your choice that's going to help you the most. In recognizing resident choice, but emphasizing that your house pharmacy is the best and most responsible choice. You're essentially leading that horse to water. You're responsibly steering them to make their own and most informed decision. Oh, I went too far. Here we go. Okay, so also a helpful document when speaking to staff, and that's the ABCs of pharmacy selection. So this is double-clicking into resident safety and staff efficiency. You have adherence to packaging standardization and hours of operation to meet the needs of residents. You have a med ordering and administration process that is standardized to help with efficiencies. In addition, you have more of a culture of accountability due to tracking capabilities built into the pharmacy refill systems. This ensures that different shifts can gain visibility to what was ordered in the previous shift so that they can ensure the meds were reordered. And I mentioned on the previous slide that drug-to-drug interactions are thoroughly vetted, which ultimately enhances elderly population support. Right, so this next slide describes the team approach, to initially differentiating your medication management program, but B, also the team approach to ensure that residents and responsible parties decide to utilize your house pharmacy. And what we see is that once a resident becomes comfortable with a pharmacy, they don't typically change. And so this is really focusing on new resident experience, those prospective residents that are touring. And as we know, the need for medication management is typically uncovered in the early stages during the touring process. And the average resident, get this, takes 10 medications per day, 3 of which are likely OTCs. So as you see, the resident starts here with the shopping phase, most likely by calling by the responsible party, emailing, possibly using a referral service. Upon deciding where to tour, the marketing director, or you may call them community relations director, establishes the medication management protocols with the prospect. This is how you manage your medication management program. Items such as, processes, training, documentation, potentially are explained to the customer. Equally, medication management is partnered with a specialized senior living pharmacy, and the marketing or sales liaison explains the benefits of the house pharmacy model like you have. And the presumption here is that competitors are not doing the same, and therefore you have a stronger articulation of benefits that your med management program offers. An adult child is dealing with a tremendous amount of pressure, and anything that relieves everyday stresses or provides a customized solution, such as not having to be preoccupied with medications, can make all the difference in selecting your community. Community marketing can express how you remove the burden of medication management from the family so they have peace of mind and incredibly convenient service. In addition, your pharmacy ensures 24/7 availability. And as you move towards the shopping, the touring, and now you're at the deposit phase. So I call it the leadership team because I know many people can take deposits within a community, your receptionist, your dining service director, whoever that may be. But that leadership team that takes that deposit has then a responsibility to reinforce the pharmacy selection, either by providing some pre-move-in paperwork with your pharmacy enrollment form in there, along with your face sheet and potentially an example of your admission agreement. And then as you move from that deposit onto the assessment, this is where our clinical or nursing teams really need to verify that pharmacy selection, certainly during their assessment. Support that decision and set the expectations about what will come next. Signed orders, to ensure that you can actually order the medication. Then as you move from the deposit, now in your assessment, now you're signing the admission agreement with your business office, so your executive director and your VOC. So you're gathering that paperwork to ensure that that pharmacy enrollment form is filled out, that you have insurance cards, that you have orders. And so as you package that up and prepare for that resident to move in, that you could hand it off to your care staff and they have everything that they need. So I just covered some roles and responsibilities, and I want to just go a little bit deeper on that. So, obviously marketing, it's introducing the initial concept. If you have your own pharmacy, this is what you can expect. Nursing team, from a clinical perspective, supporting that decision, answering any questions that they have. Many times our nurses know exactly what it is like to work with the pharmacy and can speak, very much firsthand about it. The business office or that business transaction is verifying that decision, and the care staff have everything that they need. And what we see with customers with high pharmacy participation is that each person within this process is involved. That you don't just say, no, just our nursing team talks about pharmacy, or just our marketing team talks about it. It's really a message that everyone needs to carry through, and it's not an overly complicated one, as you see. It's convenience, it's safety, it's reinforcing their decision to move into your community. So some of our customers as well, they institute fees to impact pharmacy decision, potentially calling it a non-preferred pharmacy charge. It could be an addition to their level of care as well. And what we typically see is by doing this, you have higher pharmacy participation because of these fees, or penalties, if you will. So in considering some of these fees, there's some different factors and ways to articulate the charge to responsible parties and residents. And so first of all, in considering your surcharge, how do you place a value on resident safety? How do you place a value on some compliance concerns because you don't have the med on hand, potential plans of correction that could come from med errors, or resident hospitalization? And so you can't place value on that. It's nearly impossible. But what you start to be able to place value on is some of the staffing and the inefficiencies that you're going to experience because you have multiple pharmacies. So, what we see is, those fees are instituted to recoup the inefficiency and the risk associated with handling multiple pharmacies, and to strongly encourage residents to use the house pharmacy. So I'm going to pause there for the operator, see if we have any questions.
Thank you very much, Brady, for all that great information. Yes, we would like to take some questions for our listeners now. So, listeners, if you have any questions for Brady, please type them into the Ask a Question box below the slides and click on the red Submit button, and we'll get to as many as we can. The first question we have is, you touched on this a little bit, but what's the best way to address pricing questions that may arise either from residents themselves or their family members?
Yep, and so I'll tell you how we do it. And potentially you have a pharmacy that they can accommodate this as well. But we do copay estimates prior to moving. And so it's a simple process. We have a dedicated team to do this. They actually provide, they make a phone call directly to the prescription insurance provider. They'll go through the list of medications. Based on that, we can write up what the copays will be and provide it to the resident prior to moving. So we've really made quite the stride in terms of price transparency.
Great, thank you. Another question, can you force a resident to use your house pharmacy?
I think the simple question there is no. I don't think you can force them. We've done some extensive research of why do residents choose to use us, and what we see is heavily weighted towards they just got a really strong recommendation to use the pharmacy. And many times, customers will say, well, we didn't really know we had a choice. Well, maybe that's because it was recommended so heavily, and that's kind of a whole team approach to making sure that they choose the right pharmacy. So I think the question or the answer there is no, you can't force them. But I hope you saw here that there's different tactics, to lead them towards that decision.
Another question: are residents required to be covered by Medicare Part D to use a health pharmacy?
No, they're not. No, we see that there's a small portion of our customers that are purely private pay, meaning they don't have prescription insurance. And so when we see that, we certainly want to encourage them to get on a Part D plan. But you don't have to be. Medicare Advantage plans, you can fill prescriptions through a long-term care pharmacy. And, there's certain plans up there that are probably less advantageous. Those would be, someone that is using TRICARE for life, someone that's using a mail order pharmacy. Typically there's 1 to 2 fills that you could make from a retail or long-term care pharmacy. But other than that, at times you are, for lack of a better term, forced to use a pharmacy, but you do have a choice. I think I want to emphasize that, and that's really during the annual enrollment period where you can choose a different plan. So you can start using a different pharmacy, and one that you're not penalized for filling prescriptions from.
Say there's a community that doesn't have a house pharmacy right now. What's the first step they can take to arrange for one?
Sure. Well, if you don't have one currently, to not go on a sales pitch, Omnicare is in all states. We have competitors in all states. I would start with making outreach to those companies. Most of us have an outside business development team who can meet with you, talk to you about your community, some of the challenges, some of the solutions that you're looking for. And based on that, you choose the one that fits your needs the best. And typically there's zero cash outlay for these types of contracts. Our reimbursement is based on filling prescriptions for your residents. And so know that there's a handful of companies out there that want your business and would love to have those conversations with you. And it really is just going to take a phone call or email outbound to solidify those.
What's the most important point you would like people listening today to take away from the presentation today?
Yeah, I was thinking through this, and your food, right? This comes from one of your vendors, but your kitchen prepares it. You own that product that comes out of your kitchen, right? You don't say, well, no, the food came from, name whatever food vendor. You're responsible for everything that comes out of your community. So similarly, those medications that you administer, your residents are looking to you that these, essentially are coming out of your pharmacy. So what I want to reiterate here is, in terms of, census growth, talk about your pharmacy as your business, because, hearing that from a prospective resident, and that's something that I never did when I worked in assisted living, and I'm kind of kicking myself for it. But I think in doing that, you truly take ownership and you set yourself apart. That, when you've got families that sit down with their 3 or 4 brochures and they're trying to decide which community do we want to move mom into, and medication management is a big piece of that. And they say, well, this one, they seem to really have their med management program together. They've got a pharmacy. I'm familiar with how they're going to pass meds, and I don't have to worry about it anymore. I really feel like that's a tremendous value and something that can gain you more residents in the end.
Thank you very much. One more question probably before we wrap things up. Is there a physical pharmacy within an assisted living community when there is a house pharmacy?
No, there wouldn't be. But what you can expect is deliveries, 1 to 2 times a day, availability 24/7. What you can expect is, typically there's backup retail pharmacies. So if there's something that occurs at 10 p.m. on a Sunday, a courier can pick up a med and get it to you. But based on the frequency of delivery, you really wouldn't need a pharmacy within your assisted living community.
Okay, great. Thank you very much, Brady. I know everyone appreciates your taking the time to answer their questions and providing all of that information. So we hope everyone enjoyed today's webcast. Remember that this session will be available shortly to listen to again online. So if you'd like to listen again, or if you know a colleague who would benefit from the information, please write down the webinar address that appears on your screen right now, mcknightseniorliving.com/April25webinar. Please remember that accrediting bodies dictate that CE credit will be given only to people who attend this live broadcast. Again, we'd like to give special thanks to Brady Ford for taking time for us today to frame this important issue in an understandable way for senior living providers. We'd also like to thank our sponsor, Omnicare, a CVS Health company. You can visit omnicare.com to learn more about the company. And thanks to everyone listening today. Your questions were outstanding, and I'm sure helped your fellow listeners gain an even better understanding of this topic. If we didn't get to your question during the webinar, we'll try to follow up afterwards with an answer for you. Once again, thank you for tuning in. This is Lois Bowers from McKnight Senior Living.